to be gained by doing both of these things, but the health impact in the right-hand column greatly outweighs that in the left. My CEDAR colleagues have also recently been estimating the savings to the NHS that would be attributable to this large-scale shift towards more active travel. So in this model, published this year again in the Lancet, it's assumed that a shift now to a higher level of active travel in the population would result in changes in the burden and the cost of treating 8 types of health condition related to physical activity. The estimate is that over the next 20 years, the savings to the NHS would be £17 billion. As you can see, the main savings would be attributable to savings in the costs of diabetes and heart disease. So I hope I've summarised the case why active travel is important for public health and an important issue on which public health and transport perspectives need to be brought together in the interests of moving towards a more physically active population while also reducing carbon emissions and addressing other challenges in the transport sector with the ultimate aim of a healthier population. Now, it's all very well modelling what the health benefits would be of a hypothetical scenario where everyone is doing more walking and cycling, but how are we going to get there? We have worked quite extensively in the past on bringing together evidence for the effects of different types of interventions. I'm not going to speak about that today, not least because I don't want to steal the thunder of the NICE guidance, which will be referred to later. But what I am going to do, again drawing on some of our current work, is to illustrate a few issues that are coming up repeatedly in our research that are worth thinking about in devising strategies to move towards a more active travel scenario. And to summarise, I think while there are interventions that can be effective in changing behaviour at the individual level, the inner layer of this diagram, it's highly unlikely that that would be an effective strategy at the population level without addressing all the other layers, including the social, economic and physical environmental constraints that are currently placed on our ability to do more of these things. One issue that we've come up against, and we're by no means the only group to find this, is that the approach to promoting active travel should not be solely framed in terms of health benefits. In this qualitative study, we interviewed people within our Cambridge study cohort who had moved home or moved workplace over the course of a year to find out what process they'd gone through in working out how they would travel to work in the new journey. And it won't surprise you to know that the kind of things that people were thinking about were the convenience, the speed, the cost and the reliability of different modes of transport to get to work. That seems obvious, but it's important to note that no one was primarily motivated by wanting to improve their health. And so while there will always be some people who are motivated to take up walking or cycling because they want to become fitter or lose weight or reduce their risk of diabetes in the future, and these are all very important considerations, most people are not thinking about long-term health benefits most of the time. They are thinking about how much money they're having to spend on different alternatives and how quickly and easily they can get to work, for example. So we can't expect people to respond to health messages if the balance of these factors between competing modes of transport is wrong. It's also not just about walking and cycling. So while there are measures that can be taken to promote walking and cycling specifically, again, because these are part of an overall mix of transport modes, we need to bear in mind that some measures that might be effective in promoting walking and cycling involve doing things in other modes of transport. Now, one example of this, which is particularly pertinent in Cambridge, is the combination of walking and cycling with motor vehicles. The thing is that while we might aspire to a scenario in which everyone travels everywhere on foot or by bicycle, the current reality is that the average commute distance, for example, in this country is 8.6 miles each way, which most people would regard as quite a long way to cycle every day. especially if they're not used to cycling, and it's certainly a long way to walk. So we've been exploring in our study in Cambridge the combination of walking and cycling with other modes of transport. And sorry, that was backwards. For example, either combining with public transport, so taking the bus and then walking, or indeed park and ride, for example, driving and then cycling or walking the last part of the journey. We studied a subgroup of people in Cambridge who commute to work mainly by car and looked at the factors that predict whether they would include some walking or cycling in that journey. And of all the factors we studied, by far the strongest predictor is the type of parking available to them at work. So compared to people who can park for free at work, those who had to pay were 4 times more likely to include active travel in their car commute. Those who couldn't park at work, 26 times more likely to include active travel. And again, we've got a number of analyses looking at the influence of parking provision and cost on how people choose to travel. I offer this as an example of needing to consider the factors outside the individual's control that will affect the decisions that people make. We then, more recently, have looked at what factors predict the likelihood that someone will take up walking or cycling to work over a 1-year period. And again, of all the factors we looked at, among the strongest predictors are the provision of convenient cycle routes, as reported by the participant, the availability of convenient public transport, predicting the uptake of walking, and the nature of the parking available at work. So while it's not just about health promotion, and it's not just about walking and cycling as specific modes, it certainly is about planning, infrastructure and service provision, and whether that's relating to the design of new settlements or the improvement and modification of existing settlements, is clearly an area where public health and transport can come together to optimise the environment in which people are making their choices. The location of destinations is important because distance is a very important barrier to walking and cycling. So the locations of workplaces, schools, shops and other destinations that people need to reach is very important. At the same time, we are showing the possibility of multimodal travel, walking and cycling in combination with other modes, over longer distances where distance itself is not an obstacle. And so the message here is not to lose sight of your rural commuting hinterland as a potential population in which more active travel is possible. And bear in mind that these people are spending much more than 28 minutes a day on average travelling to work. So, to summarise, if we aspire to levels of active travel that we see in countries across the North Sea, or indeed in cities like Cambridge compared to the rest of the country, merely trying to persuade people to change their behaviour is highly unlikely to be effective alone, as we need to bear in mind that while these approaches are all important part of the mix, it must be more than that. And as the editor of The Lancet said in introducing his physical activity series this year, we've been trying to advise people for a long time. We haven't been spectacularly successful in increasing the amount of physical activity in the population by doing that. We need to address the environmental constraints, and so that is the challenge. Thank you very much.